I went in with the usual level of confidence. I felt good, I was walking a lot, felt fit. They discovered a lump on my kidney that hadn't been there 6 months before. After a series of tests and consultations, we had to work out what to do. And the oncologist in Canberra explained to me the chemotherapy that was available. I'd asked him what was the prognosis. He said 3 to 5 months if you don't do anything. So I said, well, that makes the next question easy. And what do I do? He said, this is the chemo. Explained that to me and said, while you're here, I'll ring my colleague in Sydney and see if they've got any clinical trials on that you could at least explore. Went to see them, did the extra tests that were necessary. Asked them what happens if I'm admitted to the clinical trial. There's a 50% chance I would be in the chemo arm anyway, and we talked about that. But I thought it was worthwhile. I was comfortable with the fact that I was going to be an experiment, a subject for a change. So I went into the trial, got randomised into the immunotherapy arm. The good news for me was that the cancers that were visible on scans disappeared within a very short period. So I've probably been declared by them to have had a complete response now for about a year. Also good news was that the impact on me in terms of side effects and so on was quite minimal. After the first infusion, they'd warned me that I might get fatigued. Like most people who get immunotherapy, I did. About 3 days afterwards, I could hardly be bothered moving. All bar the first 2, I've had no fatigue. I drive up on a Tuesday, get to the consulting bit, get an infusion on a Thursday and get in my car and drive home. I think the important part for me was having confidence in the people treating me, and then I let them get on with it. So I don't try and second guess. I didn't come back and look up Google for everything I could find. If I look it up, I'm bound to read all the things that say it mightn't work, it might be this might happen, that might happen, and why not just ask? The person who's treating me in Sydney, he's been doing this for 30 odd years. How could I ever know enough to second guess sensibly? But at the end of the day, he's still going to know more and has seen more. All I have to do is make sure that in our relationship, he will tell me and discuss with me the things that I want to know. Getting the clinical trials better, as in more access, is important. There ought to be a one-stop shop where any clinician in Australia can plug in and see that there is a clinical trial for renal cell carcinoma. There are patients in Darwin, Sydney, Melbourne, Adelaide, wherever, and then discuss with their patient whether or not it's possible. And then you've got to go through the process of getting admitted. And then you would say, what are the logistics, all of the questions that you might want to ask. But at least you're able to ask them. If you don't know it exists, you just fall back on the stock standard, but it's your choice. So I have 2 views on clinical trials. One is that they should be as widely accessible as possible, and clinicians should find it easy to get to know what trials are available for their patients. And the second one is that we should regard them as a treatment. I know I'm some code number in some trial somewhere on some database with all my blood test results and all my responses and my CT scans and everything. But for me, I've been treated. For my family, I've been treated. And I think that if we could persuade people that they are a part of contemporary medical practice and treatment, then you would look at clinical trials a little differently from the old traditional way, which was, they were basically research projects. You were doing with human beings what you might do in your research project. You'd have a control group, an experimental group, you'd do whatever intervention you did, and you'd compare your treated group with your control group. We've got to think about how we're treating a person and their illness, not just putting them in an experiment. Then you have to say, well, what will clinical trials mean in the future when we look at personalised medicine where treatments are being developed, but recruiting 1,000 people in a reasonable period of time is going to be pretty tough. And of course, there's the clinical benefit, the benefit to the community, and so on, and there's the cost. And I think that I'm getting state-of-the-art contemporary medical treatment for a condition, and I responded very well. What I would hope would be that if there's somebody in Australia right now who has a similar condition, that their clinician, their doctor could find out easily whether there were clinical trials available, where they were, what they were, and if the person was interested in exploring them, get them at least to the point where they can see the person managing their clinical trial and see whether there's space, then you decide, I'll go for it. And I think that's been too hard. We should get the news out there and make it easy for clinicians to find out, to talk to their patients and see what real choices are available.